Hey, y'all, welcome back to part two, where we're talking about women who are caregiving for their abusers in hospice. So, if you saw video one, if you haven't seen video one, I'll link it. You need to go watch video one to kind of get an overview of my point of view and where I'm coming from. But quickly, I'll say I'm not a therapist. I'm not coming to this from a mental health perspective. I am a spiritual health clinician, and I'm looking at this through a spiritual lens. So one of the things that I have heard and seen that women who are taking care of their abusers, parental abusers, so their father or their mother, talk a lot about people telling them things like, you need to make this right before you die. Or if they are in a faith tradition that emphasizes forgiveness, you got to forgive this person, your mom or your dad, before they die. And I think one of the roles that we can help with is letting them know that you don't owe anybody a deathbed reconciliation. I actually wrote down something that I had said to a patient once, and I said, being at your parent's bedside doesn't mean that he needs to have access to your heart. He doesn't need to have access to your vulnerability. He doesn't need to even have access to your compassion. You are doing this not out of guilt, but out of what you value. And so I think that's important as chaplains, is to help people name what they value and help them align their actions with what they value. Again, it goes back to my theoretical orientation of ACT. What do I value, and how do I live my life in a way that aligns with my values? So a child who has decided that honor is important to them and they want to, or they feel like they may regret not taking care of their parent, or it's an integrity thing for them, or it's a tradition thing for them. On us as chaplains, it is not our responsibility or job to tell people how they feel, or if how they feel is right or wrong. My role is to help you excavate what matters to you, and then to take actions that align with that, whether I agree with it or not. So if someone is coming to you and saying, yeah, for reason XYZ, whether it's tradition or whether the Bible says to honor thy mother and father, and I hold that to my heart, and this is a way that I honor them, whatever the reason they give you, your goal is to make sure that is a true reason. That's what they want to do, and then help them align with it. So, but you don't have to be hurt in the process. You've already been traumatized by the abuse. You don't need to re-traumatize yourself in this caring relationship. Like, for an example, someone who has experienced SA, and it's very common in hospice for you to have to bathe the patient, right? A lot of people become incontinent of bowel and bladder, and so they're wearing pull-ups, or, they're having, if they're still going to the commode or what have you, you're having to clean them up in some way. For someone who's experienced SA, seeing their genitals may provoke a very strong reaction. I would never tell a woman that they need to do that. My goal would be, okay, you want to honor your mother and father, you want to honor your dad, understandably so. What else could we do to make sure that you honor him without re-traumatizing yourself? So now I'm helping her to explore options. In a case like that, it might be utilizing our home health aide that we have in hospice to come and do those things, or get a caregiver in to do those things. Helping them to brainstorm, how could you do this? Or maybe having another person in the family come over and help with the cleaning of that person. But my priority would be to keep that caregiver resourced to be able to do what matters most to them. Not to the patient even. Because now that daughter, that family member is my care recipient as well. And that's where things get tricky, y'all. This is why I'm always like, it takes incredible skill. And I'm not saying I even have those skills. I'm learning this right along with you guys. I've tried things that fall flat. Okay? But I've tried things that the Lord has blown on as well. And it's worked out. So I'm not speaking to you from like, I've arrived and this is prescribing what you should do. I'm talking to you through this the way that I would if we were sitting next to each other, chaplain to chaplain. So one of the things that I think is important is that we let them explore options that keep them safe. In terms of working with the child is saying to them, you know, you don't have to do this. And that's a big one. And helping them to make that decision. Like, what would happen if you completely opted out? If this is harming you, if this is bringing up, if it's re-traumatizing you, what would happen if you opted out? Again, some women don't even believe that they have the option. Like that doesn't even cross their mind that they could opt out of this. You as the chaplain coming in as non-judgmental, non-biased, your only goal is to help bring peace into this situation. So you're helping them to explore both sides of the coin. And like I said in my previous video, you may be the only person who's actually done that with them. So what does it look like to maybe reduce your visits? Like I said, delegate some care. Not be present when they die. You know, what does that look like if you just said, yeah, no, I'm opting out without explanation, but with self-preservation? You as the chaplain at that point you're speaking truth to a situation. So you're being a truth teller, but you're also kind of being a guide a little bit, guiding them through their emotions. And you are there for support. Because the worst thing that can happen is that caregiver takes out their anger and their resentment and all of the feelings they're having on that patient. And now you got an APS case on your hands. I haven't personally dealt with it, but I've done enough research and talked to other chaplains to have seen that happen. Because that anger and those feelings have to go somewhere. And if they don't process that and come up with a game plan on how they're going to deal with it, they can start to abuse the abuser. And now we're in a situation that nobody wanted to be in. So the last thing I would say to you is that you need to know your scope as a chaplain. And hospice is beautiful because of our interdisciplinary focus. We have a licensed social worker on our team. Some are clinical social workers on our team. Tap in with those people. Make sure that you are letting them know what you see, hearing what they see, naming what might be existential and spiritual versus something that might be pathological. You know, it's a delicate dance, and that's why it's really important that you spend time learning how a social worker can support them and vice versa. Your social worker needs to know not to just call you when people are crying and need prayer. They need to know that you are looking through a similar lens from a different angle. All right? And it complements one another. Because oftentimes people who are having emotional issues are having spiritual issues. People who are having spiritual issues are having emotional issues. So how do we as a team come up with a care plan to support them? So I say make sure that you are involving your social worker. If you're in a hospital setting, you may even have access to the psych doc, right? The psychiatrist. So you may not even need to work with a social worker, because in a hospital, social workers are typically limited to discharge planning. I'm just telling the truth. But that psych doc, a psych assistant, a behavioral health specialist, all of those people in hospital settings are available to you. And here's the thing that I will end this conversation with. It helps us as professional chaplains who've invested so much in growing our knowledge to be able to care for patients. This is how you get respect in hospitals and systems that value education and systems that value outcomes. Chaplains get a seat at the table when you can speak the language of the system. So the more that you understand about mental health and can speak the language of mental health while staying grounded in your spiritual expertise, and they see the outcome and the benefit of partnering with you, this is how we get respect in this industry. Because as long as they think that chaplains are just really nice people, or they over spiritualize what we do, like, I don't know what they did, but when they came out of that room, the patient felt better. Initially, that might feel all warm and fuzzy for you to feel like, yes, they think you do something magical. But for me, that's not comforting. I want them to know what I bring to the patient situation, how I help patient outcomes, and how I'm an integral part of the care team. This is how we get there. It's not doing tea for the soul. It's not walking around with candy and doing chat with chaps. That's a part of it. But that can't be the thing you lean on. Because in a hospital system, in a hospice system, in a healthcare system, knowledge is key and patient outcomes are king. So I hope this is helpful to you. As always, like, comment, share. Those little things, because I don't charge for this. I'm not a CPE educator, okay? I'm not getting $3,000 to teach. I do this out of my love for this profession and my love for future chaplains. And so the least you could do is comment, share. And for those of you who regularly comment, I appreciate you from the bottom of my heart. From those of you who regularly share, thank you. I appreciate you being here. And for those of you who are not subscribed to the channel, what are you waiting on? Subscribe. And until next time, my loves, grace and peace.